Van Halen. They wanted a doctor, so we have one in front of us. Dr. Ari Lakritz, how are you doing today, sir? Good to see you.
Oh, good to see you.
Did I get the last name right?
Yeah, Lakritz. That's right.
Oh,
Yeah,
this text line likes to tear me up every time I botch something. Not today. I'm living my Friday in good spirits.
Yeah, you missed the most common mistake, which is Lakritz.
Oh, really?
Not quite. Yeah, Lakritz.
I'll be darned. Well, yesterday, guys, remember I was telling you guys about this really insightful news story that Tim Dittman sent our way about the wide range of treatments for PTSD, and Ari, you were actually quoted multiple times in this news story, and it's great to have you here. I mean, this is really important, and there's no better time to talk about these type of things than the present, you know, and I really appreciate your time. How long have you been with OSF?
Relatively short. I started this past August over the summer.
Oh, what? Well, I got to ask, Stacy, how's it been? Has it been a good fit for OSF Healthcare?
It's been fantastic, and we've really enjoyed having Dr. Lakritz with us.
Awesome.
He's definitely a blessing for our department.
Absolutely. And, you know, young people in social media, the more I keep thinking about this, you know, and going through my own research and doing some things of my own with the show, you know, I can see it having an effect on young people in the mental health aspect of things. And, you know, when we're seeing, you know, with bullying, with sexual predators, and it's something we don't really like to talk about. But with this, you know, there's a lot of things that can trigger PTSD, correct? It's not just this conflict-driven stress, right?
PTSD, yeah, absolutely. They're starting to recognize more that it's not just victims of war, it's not just victims of serious physical or sexual trauma. These are people who, you know, were indirectly exposed to these kinds of things. First responders, EMTs, firefighters, police, the people that are seeing, you know, on a day-to-day basis the worst parts of our society, basically, the worst of humanity. You know, this kind of exposure to these things builds up and up and up.
And in terms of just, you know, young people in general, and anyone really with social media, how is it impacting our mental health? Are you seeing it making significant impacts?
It is, absolutely. For a while, this was a big debate, but the evidence is really coming together that it's had, at least for young people, possibly for adults as well, at least for young people, tremendously negative effects that seem to be outweighing any possible potential gain of things like social connection with others, things like that.
And just to add on to that, why do you think it's in more of an in-depth look? Why is it impacting us so, you know, bigly? It seems like it. Is it because it's just our emotional, you know, connection? We can't just see some things happening because we see bullying videos on social media and people getting abused or beaten. Is it just the things that we can't really handle mentally that's affecting us?
Great question, CJ. Two reasons why I think social media is so destructive. The first is that is how it is designed. It's baked into the cake.
Yeah,
it is designed.
Right.
It is designed to be addictive. It's designed to be addictive. They have, unfortunately, some of my colleagues, some of my psychology colleagues, unfortunately, have, you know, been employed by some of these companies to design them in quite the same way as casinos employ some of my colleagues, which is to make the interfaces for these systems as reinforcing, as addictive as possible.
Really?
Yeah, this is true. Yeah.
Okay, now my mind's spinning. My mind is absolutely blown.
Yeah,
that is one of the most...
Yeah. And you know, CJ, it's very interesting. You know, Adam Alter brings down in a great book, it's called Irresistible. Talks all about the effects of social media. He brings down that a lot of the creators of social media and the big technology companies did not let their own children use these devices, right? There's testimony from Steve Jobs, dinner table that there were no devices allowed. A lot of the big people, the big social media companies, forbade their children up to a certain age from ever making a profile. That doesn't bode well for the quality of these things for mental health.
That's
certainly.
A great point that I never even thought of. And, you know, with that, it seems like with the pandemic, you know, I hate to keep hitting that same point, but the pandemic really brought out a lot of awareness for mental health because I think a lot of us were cooped up at home so much, we really we couldn't run away from it anymore and put Band-Aids over it. Was that something you kind of saw too in your field, that this was a growing concern after the pandemic or even during it?
Very much so.
Okay.
Very much so. Yeah. A lot of the young people I'm dealing with now for mental health concerns, things like depression or anxiety or possibly even like the effects of ADHD, all of this was completely exacerbated by the fact that they were just in a matter of weeks plucked out of their day-to-day life, sent home, and, you know, their whole schedule and everything in social group was completely upended. I can't, you know, speak enough about the negative effects this had on the vast majority of kids.
You segued this perfectly into bringing up ADHD because this is something that I keep hearing more and more about. It seems like to me, and just wanted to ask you right off the bat, what is ADHD? Because it seems like everyone I talk to either says, "Oh, I have ADHD" or "I have ADD." Could you define it for us?
Oh, absolutely, absolutely. ADHD is a developmental condition, meaning it's a condition which we believe was in some form or another around since birth, or at least since very, very young, which messes with both a person's concentration and attention and possibly their level of activity and focus, right? So you can have two types. You can have the distractible type, what used to be called ADD.
Okay.
And then you can have the hyperactive impulsive type, which these days it's all called ADHD, but which used to be called solely ADHD. And this is something that, it's something that people love to hate, right? Because it's seen as like this thing that's just sort of an excuse for unfocused, lazy behavior, et cetera, et cetera. But when you start looking into it, you see that this has, some of the most profound effects on a person's functioning. The ADHD can so limit a person and what they're able to accomplish in life. A lot failed jobs, schooling, marriages, everything. It just touches every area of their life. And one very interesting thing is, in a clinical population, even if you're not treating the person for ADHD, there's like an old clinical rule amongst psychologists and therapists that 5 to 10% of the people you see in a clinical setting in any given clinic will have ADHD, because it is just such a trigger for all the other types of mental problems you could have.
Really?
Very much so. Yeah.
So it's almost like that gateway for things that could develop later on in life almost, right?
Well, it certainly doesn't make anything easier.
It
only makes
like
it
it.
harder.
Thank you for breaking that down, because so many times it's like, are people getting misdiagnosed? Are they even going and getting that diagnosis from, that care provider? Have you seen that a lot, where someone just diagnoses themselves and go, "Oh, I Googled it, or I WebMD'd it. I must have ADD. I must have ADHD."
Yeah. I see that with a lot of things. I see that with ADHD quite a bit. I see that with what we call today autism spectrum disorder quite a bit. There's a very strong presence on like social media platforms like TikTok and things of people who are claiming that they have these conditions and supposedly showing the symptoms of these conditions, to the world. And this, again, very influential for young people if this is their primary exposure to, these types of ideas.
I'd like to add something here.
Absolutely.
I think that another phenomenon we're starting to see more of is that with raising awareness and our primary care providers taking a more active role in having these discussions with their patients, I think we're seeing more adults come in and requesting ADHD screening, which is very relevant because this means they meet it through school, right, with a lot of symptomology, that it would have been very helpful had they had interventions earlier on.
Can I ask you about the screen a little bit? Because I'm just fascinated about that process. What does that look like? So if someone goes in and goes, "I think that I have something in line with this," or ADHD, how does that screening look?
Well, that's going to be, basically what that's going to look like is a really long, in-depth conversation with someone like myself, with a psychologist, where we're going to go very in-depth about, what was your experience like through all these different areas of your life, through schooling, your ability to, keep all your responsibilities at home in order, your performance at your job. And we're going to look very, very closely to see, are the problems that you're experiencing, are they up to the level? Do they seem to kind of fit the profile for someone with ADHD?
Absolutely. Yeah. And what's one of the misconceptions that you guys kind of see on the day-to-day basis? I'm sure there's a plethora with, something like an ADHD and with misconceptions. What are you seeing a lot of?
Biggest misconception, that only kids have it. Biggest misconception.
Yeah, and that's a great, because to me it's always, I always hear about the little ones, or especially if the mom has a lot of rambunctious kids. Oh no, they just all have ADD, or they all have ADHD, which they might, and do you think it helps or hurts whenever you have kind of you hear the parents, you hear the guardians in their life just kind of throw the blanket term over without that screening? How important is it to really get that diagnosis before we just kind of go, "Oh, well, they're just having an attention deficit disorder, or they have ADHD"?
It's very important. It's very important. Yeah, the biggest thing is that it couldn't hurt, right?
Yeah,
it couldn't hurt to just sit down with a mental health professional and sit down and try to figure this out. Let's say you don't. Let's say you have these types of problems, but you don't fit the official criteria for ADHD. Well, the strategies, not talking about the medications, but the strategies, the cognitive strategies and organizational strategies for dealing with ADHD help anyone. These are things used by CEOs. These are things used by very successful people. They can help, any type of person, but they're especially important for people with ADHD because this stops them from, really, really failing in a lot of different areas.
That's a really insightful point. And, are we seeing a lot of cases of this in the Riverbend area?
We do. We
Really?
do. Well, it's not, I don't want to knock the Riverbend specifically, but it's like I said, CJ, the old sort of clinical rule, 5 to 10% of people you see, so that's either 1 in 20 or 1 in 10, are going to meet the criteria for adult ADHD.
Now, I got to ask you, completely off of what we were talking, well, it's a spin-off question. Do you ever walk down like the grocery store aisle and see somebody and go, I'm going to bet $1 to a donut they got ADD or ADHD? Do you ever do that?
It's a little bit of a curse, unfortunately.
That's what I was going to ask you.
There's some things you sort of can't unlearn and can't unsee. So that's sort of the story of my schooling. You start learning this stuff very in depth. You start looking at the world through that way, and unfortunately, now you have that knowledge, and now what do you do with that knowledge? So hopefully, you're using it to help people.
Well, and that's the thing. When I have you guys on, especially mental health experts like oh man, there's probably a file on me at OSF now. They're going, yep, he definitely has some problems. We need to get him in,
we all compare our notes, CJ, when we come back.
Well, take us through these really, something else I wanted to hit on were these lunch and learns that you guys are doing at OSF that I think are really not only imperative, but crucial for the development and really supportive of community. And now with this, the 17th, I remember us talking, that's already filled up.
Yes, that's right. That's right. Yeah, very popular.
How exciting is it, though, to see the community really support these type of events?
Oh, it's wonderful. It's wonderful. We can only see so many people on a day-to-day basis. We only have, X number of clinicians, X number of hours in a day. So when we can have, gather the community in a large place and really give over or at least invite someone in to talk about very important subjects like this, it's very exciting for us.
Absolutely. And now with this, what are we going to be learning about on this next one on the 31st? We have that information in front of us?
We do, yeah. So we are going to be learning all about Narcan. Narcan, just for folks who don't know, that Narcan is the brand name of a particular substance that is something called a competitive opioid receptor antagonist. Basically what that means is it's something that reverses the effects of opioid, the types of extreme health problems that can come with opioid abuse and overdose and possibly death.
Well, to me, there's no better time to learn about that stuff either than learning it whenever you can, because we all have at least know of somebody or have somebody in a family that goes through these terrible experiences like opioid addiction, and being able to know this information, you never need to know it until you need to know it, it seems like. And so on this, what do these lunch and learns look like? Is it just what it says, these kind of let's have some lunch, let's have a presentation, let's kind of converse a little bit? Is that the in and out of the event?
Well, there's going to be a presentation by a professional. They're going to explain what Narcan is, the effect, the signs of opioid abuse or overdose, and especially how to actually use Narcan on your own, administer it, and possibly even save someone's life.
Wow. That is really important. And how do we sign up for those classes? Is there an easier way to do that than just calling in? Is there a website link we can use?
Right now, probably the easiest way is to call in. That's
cool.
What I have in front of me. The number, if you want to give it out, is 618-474-6240. And that's the number for the Psychological Services Department down there in OSF St. Anthony's.
There you go. Give them a call and get signed up, because this really is insightful. Now, are all the lunch and learns, they involve a different topic each, or is it a reoccurring topic, or is it a different one each time?
I'll take this one. So this set is a series of 2, and they're identical content. The second one was added because the first one we had such an overwhelming response. So I want to give a shout out to Karen from Chestnut. She's actually going to be the presenter at the Lunch and Learn. And something else that's important to note is the education will be present, the demonstration, but she's actually going to have Narcan on site for people to take home with them, which is so critical because, like you mentioned, there's many family members, loved ones, friends. You never know.
You're right.
Right? So we hope to have more lunch and learns over the course of the year, but the 2 that are scheduled right now have to do with Narcan.
And, I think it's kind of segues itself perfectly into tie this interview in a nice little package, is that, to me, when I think of, opioid abuse and I think of, drug addiction, a lot of psychological and mental, issues either develop from it seems like, or it's already been present and it's just used as that Band-Aid to kind of get people through the day. What have you seen, Doctor? I forgot how to pronounce your last name. Lakritz.
Very good. Very good.
Yes!
Yeah.
Not today. Not today. They're ready to get me. I'm telling you guys, you should look at this text line. But what are... We'll fix it in post. But what are you seeing in terms of your, studies, your field, when it comes to, opioid abuse, with drug abuse in general and mental health?
Yeah, the one thing, if I could just give over one thing, it would be that it's the biggest misnomer, it's the biggest misconception that addiction is just a biological condition. It's just a biological disease, something that you're born with, something that's just part of your personality. At 99% of the time, it comes from some type of psychological or psychiatric disorder, or it is at least aggravated by some type of disorder. This could be something like depression, anxiety, the traumatic effects of abuse, anything like that. It is so rare that you just were one day sort of exposed to these substances and developed an addiction. It is almost always has some type of disorder behind it.
That's very insightful, because I've heard time and time again, and especially, you have an addictive personality, or you have that. And so really, I mean, that's a part of a personality trait, but that's not even close to making that full picture, huh?
Yeah, certainly. I mean, a person, certainly, CJ, a person's personality can change after many years of opioid abuse or alcohol abuse or something like that. But what was the original driver? We believe these days that it was some type of psychiatric condition, that it was not simply some sort of inborn personality trait.
So fascinating. And in terms of, treating, to me, this would be a very difficult thing to do. And that's why I would really like your expertise before I let you guys go today. Whenever you're working with somebody that's suffering from PTSD, have a lot of those cases, have you worked with somebody that it's because of a drug addiction and some happening that happened because of, the use of drugs or where they are in life? Is it more difficult to treat somebody that's, on a, currently using opioids or currently on a trajectory, with PTSD compared to someone like me who's not? Is it more difficult, or is it actually easier? Yeah,
very much so. For someone actively abusing opioids, like therapy is not the first line of care, definitely. They're going to need something a little more intense. This would be something like a more medically oriented rehab program or something along those lines.
Well, and I should have phrased that better. What I meant, too, is whenever somebody's kind of getting out of that rough patch, and everyone's kind of getting back to normal, and there's still some side effects and there's still, some things going on in the mental aspect, is it difficult still to is PTSD more prevalent, do you think, in people that go through those experiences too?
I think so.
Okay.
I think so. Oftentimes you meet folks that, because of their addiction to substances, they were victimized in so many ways. They were forced into things like prostitution. They were forced into being homeless for a time. So all those come with the most horrifying experiences you can imagine. So again, 9 times out of 10, you're going to see all these sort of disorders kind of dragged along by the addiction, 100%.
And that's what I was just kind of intrigued about, if it was considered PTSD or was that just recovery, and it's really fascinating to get that insight. So, Doctor, I really appreciate it. I tell everyone you're going to be on for 15 minutes. I take you a little bit longer than that, and I appreciate your time as well, Stacy. This has been fun. And just really quick, Stacy, how cool is it to see? And you aren't very old, Doctor, are you?
I don't think so.
No,
by any standards.
Well, that's what I think is so cool, is to see someone as young as yourself really helping and providing us all this care, because we'll be seeing you for a pretty long time, I'm thinking.
I hope so, CJ. I hope so.
Yes.
Yeah.
Really cool. What's the best way to stay in touch? Stay up to date on all the developing programs that you guys are having, like Lunch and Learn, or any type of outreach that you guys do?
Well, I think our OSF website is probably the first area where you could find the most comprehensive, up-to-date information. You also could call our department at 618-474-6240, and we can help you out with current groups and offerings available.
Thank you guys so much. This was so fun. I love talking to you. Guys, you were awesome. OSF Healthcare is always great and a huge asset to our Riverbend community. At 9:37 on this 10th day of March, we got to take a break because our sports reporter's calling in next to fill us in on March Madness. And the Blues, hell froze over. They won a game. We talk all about that next in downtown Alton.